Welcome to the Commonwealth Matters. I'm Richard Nelson, Executive Director of the Commonwealth Policy Center. According to a 2020 overdose fatality report by the Kentucky Office of Drug Control Policy, at least 1,964 Kentuckians died from a drug overdose in 2020. That is a 49% increase of deaths from the previous year. So Kentucky is clearly in the throes of a drug addiction crisis. It's impacted our families, it's negatively impacted our communities, and also our workforce. So where do we begin to stem this addiction crisis? Joining me on today's Commonwealth Matters program is Jean Detherage, Outreach and Engagement Specialist with the Fletcher Group. Jean, welcome to the Commonwealth Matters.
Richard, thank you for having me here today.
Hey, I had a chance to really just became aware of your organization not too long ago, and I had a chance to look at your website about what the Fletcher Group does. And I think we'll start with the mission statement. And it says that the Fletcher Group researches and promotes effective practices and public policy to improve health and well-being with a focus on addictive and lifestyle diseases, including substance abuse disorders and other chronic lifestyle diseases. Tell us, if you would, about some of the effective practices that you have been promoting. And I guess you've been around just since 2017, is that correct?
Yes, so I formally joined the Fletcher Group in 2019. But my professional career in working with substance use disorder goes back to 2015.
Okay, great. So what are some of those effective practices and public policies that you have promoted and implemented? You know, drug addiction and the crisis that we've been in, this is not new. Kentucky has struggled with addiction for decades. I think we're seeing it maybe come to a new level of addiction and a new level of seriousness with the opioid crisis. The opioid epidemic it seems less forgiving than the others. Opioids are highly addictive and they're extremely dangerous. So hence the record number of deaths in the Commonwealth in 2020. I mean, nearly 2,000 Kentuckians lost their lives from drug overdose deaths. I believe a majority of those are from opioid substance abuse. So what are you doing at the Fletcher Group to promote effective practices and public policies to address this?
Yes, so absolutely. Of course, Governor Fletcher has been intimately involved with the substance use disorder issue, and in the early stages of the crisis, going back to his administration when he was governor of the state. And during that time, he started the Recovery Kentucky programs, which there are 18 facilities across the state of Kentucky that use a unique blended funding model to provide high quality substance use disorder treatment to individuals in the Commonwealth free of charge. And so that was how it started. And then the Fletcher Group was actually formed when Don Ball, builder of Ball Homes, approached Governor Fletcher and asked him to continue the mission that they had worked on together during his administration. And that was something Mr. Ball very much wanted to continue, and the Ball family was very generous and actually gave some seed money to our organization. We went on from there to acquire 3 other grants. One was a grant from the Appalachian Regional Commission. Another was a grant from CORE, the Kentucky Opioid Response Effort. And the third grant, which I work under, is from the Health Resources Services Administration. And so the CORE grant, one of the practices that we focused on there was the expansion of accessibility to medication-assisted treatments, but inside a primary care setting. So if you recall, during the beginnings of the opioid crisis, we had what were called the pill mills. And, you know, those were doctors that weren't necessarily acting ethically, and they would set up clinics from where they would distribute large amounts of prescription opioids under dubious circumstances at best. And so when medication-assisted treatments began to come out into the public as one method for treating opiate use disorders, there was a lot of pushback from that. So one thing that we found was that if you can situate medication-assisted treatment in a primary care setting where the individual is coming in and they're receiving care from a doctor, just like anyone else would in that primary care setting, and the other folks don't know why they're there, and they don't know why the other folks are there, it really helps reduce stigma and increases the chances that folks are going to adhere to those treatment protocols.
So was stigma something that prevented people from getting the care that they needed if they had some kind of addiction issue? Were they afraid to go into a designated treatment center for fear of what people might think? Was that keeping them back?
It's a huge issue and continues to be, especially in rural communities. In rural communities across the country, it's the small town thing. Everybody knows everybody's business. And so if you see Tom or Sally going to the MAT clinic, then you know what they're going there for. But if they're just coming to their primary care provider, they could be there for anything.
Sure. And your focus is on providing that technical assistance to rural communities, in particular regarding safe, sustainable recovery housing. Tell us a little bit more about what that looks like.
Yes, and so that really touches on the efforts that we have through the Appalachian Regional Commission as well as HRSA. So ARC funded us to build at least 3 new recovery programs. And what we're trying to do is to take the original success of the Recovery Kentucky model and add some additional resources at the front and back end, to increase the chance that somebody's going to stay in the program and finish it, and 2, on the back end, that they're going to have access to education resources and training so that they can successfully re-enter the workforce. Because we believe strongly that once someone completes a treatment event, then it's very important that they have meaningful employment to look forward to. And then the work that we do under the Rural Center of Excellence in Recovery Housing, which is the HRSA award, we provide technical assistance across the country to any county that's designated rural by HRSA. And that technical assistance is robust, from project planning to project management, helping folks figure out budgets, helping them implement evidence-based practices and implement the social model of recovery, which is what has made Recovery Kentucky so successful in its outcomes.
So along those lines, Gene, what are some of the other elements that sets the Fletcher Group apart from other recovery initiatives? We know there are many different groups, there are many different models, and there's of course a need, because we in Kentucky are in the midst of a drug abuse crisis. Really, Appalachia is in a crisis. Look, the entire country is. But what other element sets the Fletcher Group apart in recovery initiatives?
And you're 100% right, Richard. The Kentucky-based numbers are devastating. Nationally, it was 93,331 people. And I always say people that someone loved. Someone loved each one of those 93,331 folks. And when I first saw that report, I wrote that number on my heart to keep me going in this work. But so I believe what differentiates us from many other organizations is, as far as it goes, we're nonpartisan, which does play a role in the nonprofit and private substance use disorder treatment role. We're free to provide our technical assistance to any nonprofit, any private organization, any local government, any state government that wants to engage us on bringing real solutions to this crisis. And the other 2 things that we focus on, we use a unique blended funding model to build what we call the capital stack to construct these large facilities, because they're not ramshackle places. I mean, these are multi-million-dollar facilities. They're very nice, they're modern, they're clean, because we believe that being able to come into that environment itself helps the individual want to recover and be able to recover, because they're not in some dingy basement. But so through that, we try to minimize as much as possible, sometimes up to having no debt on the property, so that those organizations can focus on the operations and deliver long-term recovery housing services. And I like to put that in bold: long-term residential recovery services, because normally the only things your private insurers or public insurers will pay for are short-term stays, 30 days or less. And the neuroscience about substance use disorder is clear. You're looking at a minimum of 12 to 18 months before just the physical brain is going to be at baseline to then start pursuing some of those higher goals for somebody in recovery.
I also noticed that one of the elements that you have that does set you apart is peer-driven support. So individuals who've gone through the treatment successfully are on hand to help others who are just beginning their journey. How does that look, Gene? What does that look like?
It's really amazing to watch. And, you know, most anybody can get a tour of one of the existing Recovery Kentucky programs. And so when an individual first starts the program, they start in what's called SOS, which stands for Safe Off the Streets. And then they're immediately greeted by someone that's called a peer mentor. And so that individual is anywhere between 6 and 12 months ahead of them in the program, but has literally been exactly where they are, may have slept in the same bed that they're in. And so with the support of staff, you know, they are able to intimate their lived experience with that individual and literally be a living, breathing, concrete example of hope for that person. And it's powerful.
That is powerful. You had mentioned, so we've covered a number of different things. You have state-of-the-art facilities, you're providing housing, of course, for those going through recovery, peer-driven support, as you just mentioned, but then meaningful employment. You have work for them to do, which is part of having human dignity, right? We don't
Absolutely.
just have sidelines. We're not just consumers, but when you actually engage and work and are producing something, that helps to build your self-esteem. It helps to bring dignity. Very briefly, we're running out of time here, but what kind of employment do you offer?
We work very closely with partners throughout the state and in other states, especially our area development districts and the Kentucky Chamber of Commerce and all the work that they've done through Second Chance Employment. We try to get folks jobs out in the community, whether that's with Toyota Boshiku has seen excellent success in their partnership with the Bluegrass ad. And so we just try to plug the recovery homes into that. And there's several other examples across the state.
That's fantastic. So what kind of success are you showing for those who've completed the program? What's your success rate?
Sure. So with the Recovery Kentucky programs, and all this data is available to the public on the Kentucky Housing Corporation's website, it's approximately 62% across all the centers for individuals that enter and then go on to maintain a lifestyle of recovery at least 1 year after they've left the recovery program, which there's not a lot of study and data that's really ever been done about substance use disorder. It's really only became an item of national interest in the past decade or so. But, 2/3 doesn't sound like a lot, but I promise it is comparatively. Because you look at the effort that we've put in over the past 60 years with the criminal justice approach, in which, you punish an individual, they spend some time in prison, but then they walk out the door and they're right back in it, or they overdose and they pass away. And those numbers are somewhere in the 80s. So like if you get arrested for possession of an opiate and then you're released within 6 months of that arrest, you have about an 80% chance that you're going to have an overdose, possibly fatal.
Gene, you are doing good work. We are out of time. How would the viewers and listeners get in touch with you if they'd like to learn more or to work with the Fletcher Group in this drug addiction recovery program?
Absolutely. We'd love to hear from anyone seeking to join with us on this issue, and they can visit us at fletchergroup.org and click on the RCOE tab, and it'll pop up on the website to encourage you to request technical assistance.
Very good. Thank you so much for your time, Gene. God bless, and keep up the good work.
Thank you. You as well, sir.